So what St. Vincent Healthcare is trying to do, particularly as it relates to health insurance exchanges, is to use every opportunity we can to get the word out around what are health insurance exchanges, who do they help, how would you access them, how can people really benefit from what's being offered right now, particularly if you're in a situation where you're either uninsured or you're in a situation where maybe you really can't afford the insurance that you are currently purchasing. So how do we help people through that process?
We get a report telling us who could potentially discharge that day. And those are the people that we know are feeling well enough to have a discussion. So we would probably go see them at that point. We haven't started yet, but that's probably how we'll work it out. If the patient expresses an interest in the Healthcare Affordability Act, then I guess something will trigger for us to go see that patient before they go home.
So where we will typically see patient contact, particularly patients who are uninsured, would be in our clinics, in our walk-in clinic here on campus, in our emergency room. Those are the real sort of common areas. So what we're doing is we're taking people who already have good background, like Tammy does in financial counseling, and getting them additional skills, and they're being certified as application counselors. So if a patient arrives at our emergency room, for example, and this patient does not have insurance, then we can help them at that point in time to, with the assistance of a counselor, to be able to understand what their options are. Debt that you are incurring right now, that's one thing. But I will tell you the other thing, both with respect to this, as well as the issue around Medicaid expansion, it's consistent with our mission. So if I would direct you right straight back to our mission statement, which is to improve the health of the individuals and communities we serve with particular attention to the poor and vulnerable. And the folks who are impacted by this most favorably are the poor and the vulnerable, the working poor, the folks who have been blocked out of the insurance market, the folks who, even though they're working poor, they can't get access to our Medicaid program because our Medicaid program in this state is so restrictive. That's our mission field. What we also know, and research shows time and again, is that if people have insurance, they will use it and they will have a better health status as a result. So this really is our mission work here, because if we get people covered with some type of insurance, whether that's through an expanded Medicaid program or through Blue Cross Blue Shield, Pacific Source, or the Montana Health Co-op, they will use that insurance and then they will access care and they'll have a better health status. So it goes right back to our mission. We just help to improve the health of the individuals and the communities we serve, and we did it with special attention to the poor and vulnerable.